Sexual intimacy is a deeply personal experience influenced by culture, emotions, expectations, and knowledge. However, first-time intercourse in real life is often very different from what is shown in movies, TV, or adult content. While media tends to portray it as perfect, effortless, and always pleasurable, reality is far more nuanced. Across the world, different societies hold varying beliefs about virginity, premarital sex, and first-time intercourse. In some cultures, premarital sex is considered taboo, while in others, it is a normal part of personal growth and relationships. These cultural and societal expectations play a major role in shaping how individuals approach their first sexual encounter. One of the most widely misunderstood aspects of a woman's first time is the hymen. Many believe it is a seal that breaks during intercourse, causing bleeding and pain, but the reality is far more complex. The hymen is simply a thin membrane that comes in various shapes and sizes. It can stretch or tear due to sports, tampon use, medical procedures, or even naturally over time. Despite this, in many societies, an intact hymen is wrongly associated with virginity and purity, leading to harmful traditions, such as virginity testing before marriage. Emotional and psychological factors also play a huge role in first-time experiences. Some people engage in sex casually, while others prefer emotional connection and trust before taking that step. Regardless of personal choices, communication and consent are key to ensuring a healthy and positive experience. Misconceptions surrounding first-time sex have been widely spread due to cultural beliefs, lack of sex education, and unrealistic media portrayals. Many young people go into their first encounter with unrealistic expectations, leading to fear, anxiety, and confusion. One of the most common myths is that a woman must bleed during her first time. This is not true. Some women do bleed, but many don't, either because their hymen has already stretched over time, or they naturally have a more elastic hymen. Another common misconception is that first-time sex is always painful, but this largely depends on factors such as relaxation, lubrication, and communication between partners. With the right approach, comfort, and trust, first-time intercourse does not have to be a painful experience. There is also a widespread false belief that a woman cannot get pregnant during her first time. In reality, pregnancy can occur whenever sperm meets an egg, regardless of whether it's the first time or not. Similarly, many believe that STDs cannot be transmitted in first-time intercourse, which is completely false. STDs can spread even during the first encounter if protection is not used. Because of these risks, safe sex practices are essential. Using protection like condoms and birth control not only prevents unwanted pregnancies, but also reduces the risk of sexually transmitted infections. However, some people wrongly believe that using protection ruins the experience, when in reality, it ensures safety, peace of mind, and responsible intimacy. Beyond the physical aspects, emotional readiness is equally important. First-time intercourse should never be rushed due to peer pressure, societal expectations, or fear of losing a partner. It should be a conscious decision made with trust, mutual respect, and emotional understanding. A major factor in ensuring a positive first-time experience is open and honest communication between partners. Before engaging in intercourse, it is essential to discuss comfort levels, boundaries, protection methods, and emotional expectations. A respectful and caring partner will always prioritize comfort, ensure consent, and create a safe space for discussion. For many women, nervousness and anxiety can cause muscle tension, making the experience uncomfortable. However, this can be improved through foreplay, relaxation techniques, and using a water-based lubricant. The key is to go slow, communicate openly, and ensure that both partners feel comfortable and prepared. Bleeding after first-time intercourse is not a universal experience. While some women may experience a small amount of bleeding, others may not bleed at all. If bleeding continues for several days, or is accompanied by pain, fever, or unusual discharge, seeking medical attention is important. Some people experience unexpected challenges during their first time, such as dyspareunia, painful penetration, vaginismus, involuntary muscle tightening, premature ejaculation, or erectile dysfunction. These issues are more common than people think and are often caused by nervousness, stress, or lack of experience. In such cases, patience, communication, and, if needed, medical or psychological guidance can help. Many people expect their first time to be perfect, but in reality it can be awkward, emotionally overwhelming, or not go as planned. This is completely normal. Unlike movies or adult content, real-life intimacy is about connection, learning, and mutual comfort. There is no universal right way to experience first-time sex. Everyone's journey is unique. The key is to make informed choices, practice safe sex, and engage only when emotionally and physically ready. Whether a person chooses to wait until marriage, enter a committed relationship first, or explore intimacy on their own terms, the decision should be theirs alone. First-time intercourse is not just about physical intimacy. It is about understanding one's own emotions, setting boundaries, and ensuring a comfortable and safe experience. The more people educate themselves about sexual health, consent, and emotional well-being, the better prepared they will be to make the right decisions for their own journey.